Hi everyone, my name is Brinda and this is my Master's Counseling dissertation presentation. The study that I am sharing today looks at whether combining two very simple practices, gratitude journaling and acts of kindness, could meaningfully improve psychological well-being over 3 weeks. This is a topic I find genuinely exciting, partly because it sits right at the intersection of research and real clinical practice, which, for those of us going into counseling, is exactly where we want to be. So, I hope by the end of this, you'll walk away with not just an understanding of what I found, but with something you could actually use. So, what will we talk about? Here is a quick roadmap of what we will cover together. We will start with why psychological well-being even matters, just to ground us in why positive psychology is worth studying seriously. Then, we will look at the existing research on gratitude and acts of kindness individually, before looking at why combining them makes more theoretical sense. From there, I'll walk you through how I designed and ran the study and share the results, and then the part that I am most excited about, we will get into what all of this means for counseling practice and what the real take-homes are for you. There's also a reflective moment towards the end of this presentation, so keep your thinking caps on for that. So, why are we studying this at all? Why does psychological well-being matter? The concept I'm working with is called subjective well-being. It is defined simply as how people evaluate their own lives, both emotionally and cognitively. So it's not just about happiness in the moment, it's about whether your life, on reflection, feels good and meaningful. The reason why subjective well-being matters is that it's not just a nice to have. Higher subjective well-being is consistently linked to stronger relationships, better physical health, greater resilience, and more prosocial behavior. It's upstream of so much of what we care about in counseling. It is typically measured across three components: positive affect, negative affect, and life satisfaction. And crucially, these components respond to psychological intervention. Self-esteem turns out to be one of the strongest predictors of subjective well-being, and life satisfaction can shift when psychological conditions are right. It's not fixed, that's really important. So let's talk about gratitude first. There's an important distinction to make here: gratitude as a state versus gratitude as a trait. State gratitude is that brief appreciation you feel when something good happens. Trait gratitude is a more stable disposition, a general tendency to notice the positive and feel thankful for it. What's interesting is that research suggests regularly practicing state gratitude actually builds trait gratitude over time. So it's not just a feeling in the moment, it gradually changes how you're oriented towards life. The research on outcomes is strong as well. There's a study that found that gratitude interventions reliably enhance satisfaction across diverse populations. There's one more study that added an important nuance. The benefits are amplified when gratitude is expressed outwardly, not kept private. That's actually a very theoretical reason we included acts of kindness alongside journaling, as we'll see in a moment. The mechanism seems to be a cognitive one. Gratitude journaling trains your attention. You start to notice the good that was always there, but wasn't being registered. This is called gratitude as cognitive lens model, and it becomes central to how we interpret our results. Now, onto the acts of kindness. There are three main reasons why kindness practices improve well-being, and they map really nicely onto different levels of psychological functioning. First, there's social connection. Kind acts create positive social bonds. They increase your sense of belonging and purpose. There's a study that showed this clearly. Doing something kind for others shifts how connected you feel, which in turn affects how you feel about yourself and your life. Second, there's what I'm calling the competence loop. When you do something kind and it's received well, or when you just feel good about having done it, you get both external positive feedback and an internal sense of contribution. That feeds back into a more favorable self-evaluation, and self-evaluation, as we established, is one of the strongest predictors of subjective well-being. Third, there's a study given by Fredrickson called the broaden-and-build theory. The study is that positive emotions, even small ones, gradually expand your cognitive and psychological thinking. They build what Fredrickson calls durable psychological resources, things like resilience, social capital, and self-efficacy. And critically, there's a meta-analysis showed that these well-being benefits don't require grand gestures. Even brief, low-burden kind acts are enough to move the needle. That's reassuring, and it was a big part of how we designed our intervention. So why are we combining them? Why not just study one or the other? The answer is that they target different parts of the psychological pathway to well-being. Gratitude journaling is essentially cognitive. It's about internal reflection, noticing what's good, reappraising your situation. Acts of kindness are behavioral. They're outward. They generate real social experience. They create actual feedback from the world. Together, they cover the full loop. You're not just thinking differently, you're acting differently. And that action generates evidence that confirms and reinforces the new thinking. Neither practice alone is as complete. This is why the combination is theoretically compelling, and that is why I wanted to test it empirically. Okay, so let's get into the study itself. This was a within subjects pre-post design, meaning each participant served as their own control, completing measures before and after the intervention. It was quantitative and longitudinal study over 3 weeks. The intervention was delivered entirely online via SciToolKit, which made it accessible and self-guided. Participants were asked to journal a few things each day that they were grateful for and to perform one act of kindness per week. To measure the outcomes, I used two well-validated scales. The Rosenberg Self-Esteem Scale scored out of 40 and the Satisfaction with Life Scale scored out of 35. Both are widely used in positive psychology research. The analysis was paired sample t-test, comparing pre- and post-intervention scores. After list-wise deletion, removing participants who did not complete both time points, I ended up with 35 participants. The mean age for this study was 21.4 years. Right, so what did we actually find? Looking at the charts on the screen, you can see participants' scores before and after the 3-week intervention for both life satisfaction and self-esteem. And encouragingly, both moved in the right direction. For life satisfaction, we got a t-value of minus 3.13 with a p-value of 0.004. Now, what that means in plain terms is that the improvement we saw was statistically significant. In other words, it's very unlikely to be just random variation or coincidence. The effect size was 0.53, which is considered a medium effect, so not a dramatic transformation but a genuine shift. For self-esteem, the results were a little stronger with the t-value of minus 4.19, p less than 0.001, and an effect size of 0.71, which falls in the medium to large range. What's worth noticing here is that self-esteem is generally considered quite a stable characteristic. It doesn't tend to shift easily, so seeing it move meaningfully over just 3 weeks is an interesting finding, even if we should be cautious about overstating it. So, both outcomes improved, and the changes appear to be statistically reliable rather than just noise. That said, without a control group, we can't say with certainty that the intervention itself caused these improvements. And I'll come back to that when we talk about limitations. But as a first look at this kind of combined practice, the results are promising. Now, let's make sense of those numbers because data without interpretation isn't much use to anyone. Starting with life satisfaction, I think what happened here is that Wood 2010 predicted that gratitude has cognitive lens effect. Daily journaling didn't change participants' life objectively, but it gradually recalibrated how they perceived those lives. It shifted attention towards what was already working. And I want to be clear, this isn't toxic positivity or forced optimism. It is a trained reorientation of attention. For counselors, what's powerful about this is that life satisfaction often feels fixed to clients, like something that just happens or doesn't. Our data suggests that it can possibly mean that in 3 weeks of low effort and daily practice, a shift can be seen. For self-esteem, this was a stronger effect. The mechanism appears to be the competence loop I described earlier. Performing kind acts generates positive social feedback, and an internal sense of contribution, which feeds back into a more favorable self-view. What I find clinically significant here is that this didn't require grand gestures. One act per week, something small and manageable, was enough to begin shifting how participants felt about themselves. That has real implications for how we work with clients who have low self-worth. And underpinning both of these is the broaden-and-build theory. The small, repeated positive experiences compounded over 3 weeks. Participants didn't need a breakthrough moment, just psychological tasks that can be meaningfully adjunct to the therapeutic work. One important thing to notice is that due to the lack of any controlled condition in the study, the improvements we observed are consistent with the intervention, but causation cannot be claimed. Like any study, this one also comes with certain boundaries on what we can conclude, and we have to be clear about those boundaries. The most important one is the absence of a control condition. This was a within subjects design, which means we can say that the scores improved over 3 weeks, but we can't say definitively that the intervention was the only reason for it. Things like natural changes over time or increased self-awareness from being in a study could also play a role. In terms of the sample, 35 participants completed the study out of the 98 who began. Retention in self-guided online interventions is a known challenge in the field, and our completion rate reflects that broader pattern. It does mean we should be thoughtful about who the findings apply to. People who complete a 3-week self-guided program may differ in motivation or circumstances from those who didn't. The sample was predominantly male and drawn from a single university, which naturally limits how widely we can generalize. Positive psychology interventions can respond differently across gender, culture, and life context, so replicating this with more diverse sample would be a valuable next step. And finally, we measured outcomes immediately after the intervention, so we don't yet know whether these gains hold over time. That's one of the most interesting open questions the study leaves behind, which brings us to where the research could go next. The most valuable additions would be a waitlist or active control group to strengthen causal interference, follow-up assessments at 1 and 3 months to test for lasting effects, and mixed methods to understand not just whether the intervention works, but how and for whom. It would also be worth examining moderators, whether factors like baseline well-being, personality, or dispositional gratitude shape how much someone benefits. These aren't gaps that undermine what we found. They are the natural next questions that a meaningful set of results tend to open up. Okay, so this is the section that I have been building towards. What does this actually mean for practice? The most direct application is simply assigning this as a structured homework. 3 gratitude entries per day and 1 small act of kindness per week. It's low burden, accessible, and the data suggests that it can possibly work. A key clinical tip would be to frame it as an experiment rather than a prescription. This takes the pressure off, reduces performance anxiety, and tends to increase the buy-in, especially with clients who are skeptical. What I love about this combination is that it creates a complete cognitive behavioral loop. The journaling is cognitive reappraisal. It shifts how clients feel and think about their lives. The kindness is behavioral activation. It generates real-world experiences that confirms the new thinking. Cognitive reappraisal alone can feel hollow. Behavioral activation alone can feel mechanical. Together, they reinforce each other. That's clinically and theoretically grounded. For those of us drawn to Rogers, this fits naturally. Gratitude and kindness practices give clients a concrete, daily way to extend unconditional positive regards towards others and towards themselves. They also support self-actualization by fostering a sense of agency. Clients aren't just waiting to feel better, they're actively cultivating it. There's something really powerful in that shift. The online self-guided format makes this highly scalable. You don't need a therapist present or a clinical setting. This makes it applicable in university counseling services, student well-being programs, NHS pathways, and community mental health settings, where access and costs are real barriers. It has genuine public health potential. Before we get to the final take-home message, I want to give you a moment to actually sit with this, because I think there's more valuable than just hearing me summarize. So I'd love you to pause here and consider. There's a few questions. If you were working with a client who had low self-esteem and poor life satisfaction, how would you introduce gratitude journaling in a way that feels authentic rather than forced? What language would you use? Another question to think about is, can you think of a client, past, present, or imagined, for whom acts of kindness might actually reinforce a sense of self-worth? And what would that look like in practice? Also, you can think about some barriers that our clients might face with these kind of practices. And what would you adapt the approach to meet them where they are? Take a moment, pause the video if you want, and genuinely link these through. These are the kind of questions that turn research into real clinical skills. So, to bring everything together, what does this all actually mean? At its core, this study suggests that gratitude and kindness used together do something neither quite manages alone. Journaling shifts the internal narrative, how clients talk to themselves about their lives. Acts of kindness create real external experiences that begin to conform a different story. One works on the mind, the other works through behavior, and together they reinforce each other in a way that feels theoretically coherent and based on our results practically meaningful. What I find most relevant for practice is how accessible this is. There's no special training involved, no complex protocol, or no costly resources. 3 things to be grateful for each day and 1 small act of kindness. That's the whole intervention. And yet, over 3 weeks, we saw measurable changes in both life satisfaction and self-esteem, the 2 outcomes that enormously matter to the clients we work with. I think there's something quietly significant about being able to offer a client something concrete to do between sessions, something grounded in evidence, something they can actually manage on a hard day. It doesn't replace the therapeutic relationship, and it's not meant to. But as a complement to that work, it has real potential. So this brings us to the end. Thank you so much for watching. I hope this has been useful, whether you are a student, a practitioner, or just someone curious about positive psychology and well-being. If you want to explore the research further, the key references are on the screen. And if you have any questions or anything to discuss with me, my contact details are on the screen as well. Take care of yourselves, and thank you so much for your time.